Hello, and welcome back to 10 Minutes With. Today I'm joined by Sarah Baker, CEO of CAMRARE, the Cambridge Rare Disease Network, to talk about their Rare Patient Passport. Thanks for joining me, Sarah.
Thanks for having me.
So can you tell the people at home, what is the Rare Disease Passport? How did that come about? What's its origin story?
So it came about because some of our patients, and I'm sure people listening at home will really understand this, carry around with them so much information. A lot of it's in here, but actually when you're having to repeat your story and make sure you've got all your medical information, it can become quite burdensome.
Yes.
So this 2-page document
Very lovely.
was born to really secure the key information and also distill it so that actually a professional could pick this up and work with a patient really efficiently from the word go without us having to do that repeater information. And I think that's really important. And especially the patients have said to us that have had this, and we've had over 3,000 requests for it.
Wow.
It's across, so it's not just in the UK. So it is, there's been global requests. So our last request actually was from Australia.
Lovely.
For a patient group that wanted to work with us to further develop aspects, and that's something we will do. So we will work with organisations to support the passport and how that fits
Into their national contexts.
Yeah, so we make sure that we're very, very responsive.
That's lovely. And so obviously it's been born out of a need, like you say, that so many of the people at home I'm sure will be fully aware of and will have experienced themselves. What do you think that gap that you're trying to fill can tell us about health systems at large and the experience of the rare disease community at large?
I think we've heard this quite a bit actually, the fragmentation of information, but actually when you're just thinking about the individual patient and you can travel just from one doctor to another or a specialist consultant, and actually they're looking at you for different aspects.
Yes.
And so because of that, we're not seeing that holistic approach. The other thing I think it does, and I know for some families, it's peace of mind if their children have got this on them.
Yes.
And they know that they can say to the after school provider or where they're going for a club or they're going on a trip, actually they've got their passport with them just so that they know that there's enough information there. So I can talk through a few of the sections as well if that's helpful.
Yeah, please do, to give the people at home a bit more of an idea of what you're looking at, because like you say, it's geared towards clinicians, but it's also meant to be accessible to other people in a child's wider life. And I think that was important in the creation process, wasn't it, to make sure that this could be used in a lot of different contexts.
Absolutely. And I think yes, we're looking at it for children, but this is brilliant for adults as well. So yeah, your diagnosis and your symptoms, because not everybody, as we know, has a diagnosis.
No.
And we know how tricky that can be, but actually distilling that information, thinking about those key contacts as well, because you might have your contact at home, but it might act where your, say, doctor's is, but actually it could be a consultant that's seeing you at the moment.
Yes.
So actually knowing that there's movement between wider clinical information and then what normal looks like and knowing that no rare disease journey is the same.
Yes.
Everybody's unique anyway. Being able to capture the normal, I think is really important, because then if there is a difference and there is an emergency situation, there's an easy response, which leads me into emergency information and how actually you care for that individual that's on here. So yes, it captures a lot of information, but it's really simplistic in the sense of it's actually what you need there and then, not that huge big file.
Yes, exactly. And I think that in and of itself is so empowering that you don't have to bring the huge, we've heard stories of people bringing wheelbarrows worth of paper around, and actually this is designed to be put in a pocket in a it's designed to be very transportable, right?
Yeah, and I think it was during COVID, I think people were sort of talking about how they can distill information. And I know that we ended up with the sunflower lanyards.
Yes.
And we've talked about making sure that they're visible or available to individuals. So yeah, I think that's really, really important. I know some people carry like a medical pouch,
yes,
and they've been put into there as well.
amazing. And to flip this on its head a little bit, obviously so far we've been discussing why this is important from the patient perspective. What's some of the feedback that you've had from clinicians maybe who have come into contact with people using the passport, or who you work with, to get kind of feedback from that other side?
They've said that it's given them a head start in
Yes.
knowing the patient that's sitting in front of them, without feeling that they have to do the "can you tell me about yourself?" and them feeling like, oh. So I think that was one of them. I think the other one was the fact that it helped them go straight in at a personal level, and also know the do's and don't aspects. So that top 3 things that are most important, I think, was really, really key. And one clinician was saying that was absolutely vital for them to be able to know actually what would increase anxiety.
Yes.
So how they could set up the meeting, how they could then further support with the sharing of information during that meeting, but also who was important in the family to be part of those conversations.
Yes. And so often we do talk about patients, but actually, especially when you are talking about children, really this is a whole family experience. So the document is not just about and for the child, but it's about easing the experience of everyone in the family, from parents, siblings to wider family, and maybe even friends as well.
Absolutely.
And what would be your dream? Like, talking big picture, what is the end goal for the passport? What would you really like to see come to fruition as a result of this project?
Well, there are some exciting developments, so I will say watch this space.
Please do.
And I think from our point of view, we want to work with other charities to think about how we're utilising this, especially from an education point of view. But wider than that, we want to make sure that we keep it so it is a distilled piece of information. We're not going to go into here's a booklet on your rare disease passport.
No.
But we are going to think about other ways in which we can further develop it so it's more accessible. We are very close to a new translated language version as well.
Amazing.
So we are looking at accessibility.
So we always like to end these conversations with, well, in this context, 2 kind of cries. Normally a cry to policymakers, so let's start there. But then I think in this instance as well, it's also important that we include a cry to the clinicians themselves, to the people who may be coming into contact with this for the first time. So what would be your message to those people?
I think what I'm hearing from policy, if we can get the pace increased for removing some of the red tape, I think that is going to be critical. Obviously, we've got the new draft regulations out within the UK. We've heard about across Europe. How does that marry up? And how do we make sure that we're working together? And everybody involved is part of those discussions. I think, I think that collaboration, that open discussion and being totally honest, I think that's really, really important.
Yes.
For a clinician coming across this, I think really embrace the fact you're being given that information, but look for the personal information that allows you to really connect very, very quickly. And I think that goes back to what CAMRA is all about, that connection and that collaboration really quickly. And I think that makes this the success for the patient and for those that are treating and supporting them.
And if someone at home has been watching this conversation and thinks, you know, that could be really helpful for my community or even just my family, how can they go about getting the passport for themselves, or maybe reaching out to make some modifications, for example, like you said, for different national or disease contexts?
So straight onto our website. So it's camraredisease.org, and you can find the link. Failing that, link in with me in any format, and I'll guide you through the process.
That's so wonderful. Thank you so much, Sarah.
All right, thank you very much.
You have been watching 10 Minutes with me, your host, Rhiannon Walls. Make sure to tune in next time.